Part of Governor Abbott's plan to loosen COVID-19 restrictions includes medical procedures. Beginning April 22nd, any procedure that would not deplete the hospital capacity or personal protective equipment needed to cope with COVID-19 can go on. This morning, I'm joined by Dr. Christine Lee from Texas Oncology in the Woodlands to talk more about this. Good morning to you. And how big of a relief is this on you at Texas Oncology and for your patients as well?
Right. Thank you. Yes. So a couple of weeks ago, in an effort to save the personal protective equipment in the hospitals, the governor did issue an executive order that basically ceased all surgeries in the state of Texas. So the surgical community is extremely relieved that Governor Abbott issued this new executive order, which allows us to start getting back to taking care of patients and being able to meet the standards of care for their specific diagnoses. And this is particularly important for our patients with cancer, where surgery is often a part of the multidisciplinary approach to curing the cancer. This pandemic has certainly redefined what is elective and non-elective for our patients with cancer.
So have you been able to already start scheduling those and getting them on the calendar then to have those patients lined up and ready to go?
Sure. So at Texas Oncology, we have interpreted Governor Abbott's executive order as a green light to proceed with surgery. So yes, we have encouraged our surgeons to start scheduling procedures for our patients with cancer diagnoses and other diagnoses where standard of care requires surgical intervention. With two caveats, though, we do think that it's important that the hospitals can accommodate the surgical volume and that the patient and the surgeon are comfortable proceeding with the operation itself. I do think that the executive order from the governor appropriately places. The executive order.
I was just going to ask you what kind of precautions you are having to take.
Sure. So we are continuing best practices for regular screening at the front doors. Employees are performing regular self-temperature checks and providing logs of those temperatures. We're providing and requiring masks and limiting visits to patients only. We are performing the bulk of our office visits with a telemedicine approach. And from a surgical perspective, while universal COVID-19 screening is not yet available, we anticipate some protection in that regard in the future.
And I do apologize for the delay. It is a little bit difficult sometimes to talk, but you're doing great. I wanted to ask you about your cancer patients and all cancer patients in our area in general, because we know that they have a compromised immune system from the medications they take. What kind of reassurance are you giving your patients? And overall, how do you feel like they're faring in this? Because I know it has to be pretty scary. It is for all of us, but especially if you have a compromised immune system.
Sure. So we are all very concerned about the welfare of our cancer patients, and they are definitely a special subset of patients whose immune systems are compromised, regardless of whether they're on active treatment. Patients with cancer generally require multiple visits, and they're in and out of the hospitals receiving imaging studies and so forth. So they are very familiar with their own compromised immunities. It has been actually very rewarding for us to see patients become champions of their own health care. And they practice social isolation without a lot of cajoling. So that's been very rewarding. We have been very proud to see our own patients in active chemotherapy band together and make it through this crisis. So we haven't actually had to require a lot of giving out of advice, but rather we're continuing to cheer them on from the sidelines and letting them know that we're all going to get through this together.
Oh, that's great. We'll continue to do the same. Thank you for bringing us up to date, and I'm so glad that things are starting to get back on track for you all, and I hope it goes very smoothly.
Thank you very much, and stay safe.